Female sex organs and reproductive system. The female reproductive system is made up of external and internal organs that work together to enable sexual reproduction, hormone production, and childbirth. External sex organs, collectively called the vulva. 1. Mons pubis, fatty tissue covering the pubic bone, typically covered with pubic hair after puberty. 2. Labia majora, outer lips, folds of skin that protect the other external structures. 3. Labia minora, inner lips, thinner folds located within the labia majora. 4. Clitoris, a highly sensitive organ with thousands of nerve endings, primarily responsible for sexual pleasure. 5. Urethral opening, the exit for urine located just above the vaginal opening. 6. Vaginal opening, entrance to the vagina, also known as the introitus. 7. Perineum, the area between the vaginal opening and the anus. Internal reproductive organs. 1. Vagina, a muscular canal that connects the external genitals to the uterus. Functions as the passage for menstruation, intercourse, and childbirth. 2. Cervix, the lower part of the uterus that opens into the vagina. It dilates during childbirth and allows menstrual blood to pass. 3. Uterus, womb, a hollow, muscular organ where a fertilized egg implants and grows during pregnancy, aligned with endometrial tissue which sheds during menstruation if there's no pregnancy. 4. Fallopian tubes, narrow tubes that connect the ovaries to the uterus, site of fertilization when an egg meets sperm. 5. Ovaries, almond-shaped glands that produce eggs, ova, and hormones such as estrogen and progesterone. Menstrual cycle, overview. Average cycle is 28 days. Phases. 1. Menstrual phase, bleeding. 2. Follicular phase, egg matures. 3. Ovulation, egg is released. 4. Luteal phase, uterine lining prepares for pregnancy. Historical perspective. Ancient history. Egyptians and Greeks had early texts on gynecology. The Hippocratic school believed the uterus could wander, hysteria, a myth that persisted for centuries. Female anatomy was often misunderstood, with male anatomy used as the reference point. Middle Ages. Female reproductive health was often shrouded in religious beliefs and superstition. Women healers and midwives played key roles, though their knowledge was rarely formally recorded. Renaissance and Enlightenment. Anatomy began to be studied more scientifically. Thessalus and later anatomists corrected many misconceptions, recognizing the clitoris and uterus more accurately. Still, women were often excluded from the field, and much knowledge came from dissecting female cadavers. 19th to 20th centuries. Rise of gynecology as a medical specialty. Development of contraception, better understanding of the menstrual cycle, ovulation, and hormones. Feminist movements began to push for better education and autonomy over female reproductive health. Modern era. Advances in reproductive technology, e.g. IVF, contraception, menstrual products. Greater focus on reproductive rights, gender identity, and inclusive healthcare. Better education and scientific understanding, though cultural taboos still persist in some areas.